I actually serve as the WIC director for the Northeast Texas Public Health District. We provide nutrition and breastfeeding support to pregnant, breastfeeding, and postpartum moms, also to infants and children up to age 5. We create a space where our families, whether it's mom, dad, that may be expecting or have a little toddler, can come and learn about infant feeding, child development, what to offer at different stages of life, how to have a healthy pregnancy and what to eat and how to budget. We also provide services to our fathers. And this is something new, and we're focusing on fathers because we found that they do have an impact on good birth outcomes and how children thrive in school. So we have childbirth classes for our fathers, we have breastfeeding education, we have sessions on understanding fatherhood and brain development, how fathers play a role in brain development, but also we make sure they're able to understand, how do I support mom during that pregnancy and what does it mean to bond with my baby? So here in WIC, we've kind of expanded our services so that we're inclusive of fathers, but also we create a space for families. And whether it's questions about, what resources are available to me, we offer actually resources to other community programs, whether it's to address food insecurity, housing, transportation. So we try to serve as like a hub for families, regardless of the questions or needs. We try to make sure our nutritionists are available and trained to answer those questions. Also with breastfeeding, we actually have breastfeeding mentors that we call breastfeeding peer counselors. These are moms that have already breastfed successfully, so they're able to help other moms navigate and meet their breastfeeding goals. We issue breast pumps, nursing pads, bras, but for those infants or those moms struggling, we have lactation consultants on site that handle like our high-risk cases that we often see. We've now started partnering with our local physicians and medical providers to receive referrals for those families, because it can get challenging having to better, understand how to navigate through breastfeeding needs. So we're doing that now, and it's going successful. Our physicians, they're doing a wonderful job sending families to us. Here at WIC, we offer nutrition education classes that our physicians also support us in referring families to, where we talk about healthy snacking and how to make good food choices when shopping. And so we've just found that to be really helpful, just a space for families to listen and learn from one another. But also we work to make sure that our families know there are no services that we cannot find access to. And so one of our biggest things is addressing the deficiencies in what we find in our families, whether it's iron, calcium, and so we prescribe a food package to them. And according to their needs or their age or whatever health condition they are experiencing, we actually issue the food benefits and packages according to their health needs. But what we do, we take a really close look at their iron level, because anemia is common when it comes to pregnant breastfeeding our little infants that are turning 1 and our toddlers. So we do take a look at that closely, and we work closely with our physicians to make sure we're providing the appropriate referrals. So we do some lab when they're here. We do a health history to check in and make sure there's no health conditions that we're missing, because food is medicine. It plays a huge role in how you feel, whether it's your energy level, how you, like you're sleeping, if you're properly hydrated and nourished, the way you sleep and the energy level and just your overall health, it just makes a difference. So we prescribe food for those families to help with their overall health and well-being. So we do things a little different, where we're now providing care coordination for our pregnant moms. We call this the DREAM program. And in our department, we have the Healthy Texas Mothers and Babies program. And in DREAM, we have community health workers that work with our moms to provide care coordination to moms that are high risk, whether it's hypertension, diabetes, they've had previous preterm babies, and we link them to services, but we also provide what we call tea time, monthly education classes on what warning signs should they look for, nutrition, diabetes education, hypertension, and we make sure we create this space where moms can learn from other mothers and from other professionals. So this is something we're doing. It's a little new, but it's shown to be effective when moms feel they have that support from their community and from skilled employees and staff that specialize in nutrition and breastfeeding and linkage to resources. And so that's where our Healthy Me, Healthy Babies Coalition comes in. This is a coalition of individuals that support moms through maternal, child, and health, whether it's home visiting, food insecurity. So the WIC program, we're doing little things a little different than other WIC programs, trying to make sure we address the family as a whole. And our goal is to make amazing children, amazing kids. That's our overall goal. But we do that through our nutrition education, our resources that we are linked to in the community that we can provide for our families, and having skilled staff like our nutritionists, our dietitians, our IBCLCs, and our breastfeeding peer counselors.